Hello and welcome to this video. Here we will discuss the homeopathic remedy named Graphites. About this remedy, we will discuss its name, source, prover, miasm, introduction and history, its common introduction for description, preparation, constitution, ailments from, seat of action, that is sphere of action, characteristic mind symptoms, characteristic physical guiding symptoms, important characteristic particulars, general modalities, and remedy relationship. Before we progress with this remedy, please subscribe to our channel and press on the bell icon. Please watch this video till the end. We have a quiz section coming up. So let's begin with its common name and its source. Common name of graphites are black lead or the plumbago. Source of graphites are mineral kingdom, that is amorphous carbon. Graphites was proved by Dr. Hahnemann. This remedy has soramiasm in its background. Thermally, the graphitis patients are chilly. Introduction and history. Graphitis is a great antisoric polycrest remedy which is known to the world since a very long time. It is a deep-acting constitutional woman's remedy having a respectable place among all the important polycrest remedies. It is a blackish grey, soft, lustrous solid which is composed of hexagonal crystalline scales. Next to diamond, it is the purest form of mineral carbon that occurs in nature. Constitution. Graphitis is best suited to women, especially stout, fair, and flabby. At the climacteric age, having a habitual constipation with a history of delayed menstruation, unhealthy skin, anemic face, brittle nails, split hairs, timid and talking cold very easily. Ailments from suppression of skin eruptions, overlifting, grief and vexation, extremes of cold and heat, bathing, indigestion of diet, suppression of food sweat, fear, masturbation, and sexual excess. Pathophysiological changes. It acts specially on the skin, producing various type of skin eruption with oozing of watery, transparent, sticky fluid. It acts on the mucous membrane of the digestive system, causing a chronic constipation and diarrhea. It acts on the female genital organs, producing excessive menstruation and leukorrhea. Acts on the sexual organ, more especially on the ovaries and the testes. Exerts a general influence on nutrition and upon the skin, producing a very scabby eruption. Acts on respiratory system, producing respiratory complaints. Characteristic mind symptoms: changeable mood, sad, with thought of dead and a weeping disposition, very timid, tendency to be frightened, dread of work, hates work, ill humored, fretful, irritable, great anxiety, much inclined to grief, very forgetful, cannot remember recent events but can remember past events, full of fear in the morning, child is impertinent, laughs at reprimands, excessive consciousness, hesitates, timid, unable to decide anything, very sad and despondent. Music makes her weep, thinks of nothing but death, sensation of cobweb over the forehead and face, always tries to brush it off, fidgety while sitting at work, thoughts of many things at night which prevent sleep, feels drunk when rising from bed in the morning, dullness of head with attacks of dizziness, menses. Menses are very scanty, late, pale and irregular, with violent colic. Menses are delayed from getting feet wet. Nails. Nails are very brittle, deformed, crumbling, painful, sore, thick, and crippled, as if ulcerated. Offensiveness. All discharges from the body are very offensive, foul, belching, acrid and offensive, stool brownish, undigested, and intolerably offensive. Morning sickness. Morning sickness during a menstruation with great prostration and weakness. Constipation. Very chronic constipation. Stools are very difficult, hard, knotty, large, with lumps, smarting, sore pain in anus after stools. Cracks or fissures. Cracks or fissures at the end of fingers, nipples, anus, between toes, labial commissures, bleeding, skin dry, inclined to crack. Aversion. Aversion to meat, fish, salt, cooked food, sweets. Decided aversion to coition in both sexes. Cold. Takes cold very easily, sensitive to draft of air. Hearing. Patient hears very well in noise when riding in a car, carriage, or when there is a loud sound. Diarrhea. Diarrhea is very common. Stool fluid mixed with undigested particles, brownish and very offensive. Leukorrhea. Leukorrhea is a gushing type of leukorrhea, very acrid, excoriating, white, profuse. Leukorrhea before and after menses. Eczema. Eczema of lids. Lids are red and margins are covered with crust and scales. Eruptions is moist and fissured. Alternation. Symptoms appears alternately. For example, skin symptoms alternate with digestive symptoms. Habitual erysipelas often alternate with tawdry eruptions. laughing and weeping alternate with each other. Flatulence, abdomen full, distended from accumulation of gases. Flatulence, everything eaten seems to turn into gas. Abdomen distended with dropsy. Pain, rumbling, burning, cramping, and gripping pains in abdomen due to collection of gases, burning in a round spot on the vertex. Phlegmonous erysipelas with stinging and burning pains starting from the right side and going to the left side. Oversensitiveness. Patient is oversensitive and cannot tolerate the smell of flowers. Music causes weeping. Senses abnormally acute. Hardness and induration. Heart psychiatrisis. Remaining after a memory abscess. Retarding flow of milk. Cancer of breast from old scars and repeated abscesses. Moist, gluey skin. Skin dry, rough, breaks easily, and exudes a gluey moisture. Eczema and herpes oozing a gelatinous fluid which is watery transparent, thick, honey like, clear, and sticky. Sensation. Sensation as if uterus would press out of the vagina. Debility. Great prostration and weakness. Sexual debility from a sexual overabuse. Reluctance for intercourse. Rush of blood. Rush of blood to the head with distension and flatulence of abdomen, or rush of blood to head with flushed face. Gastralgia. Intolerable gastric pains, better by drinking hot milk or by eating. Desires. Great desire for hot milk as it relieves gastric complaints and constipation. If you have found value in this video to the homeopathic materia medica, please don't forget to like, share and comment this video. Let me know which remedy would you like me to develop next. Thanks for watching and please don't forget to subscribe to my channel.